In this video, I will be talking to you about PleurX catheters, which are a good option for the management of recurrent ascites, which is fluid buildup in the abdomen, and recurrent pleural effusions, which is fluid buildup around the lungs. We'll be talking about who should be getting them, what to expect after the procedure, what are the possible complications, and how to manage them as you keep living your life. So let's dive in. First, let's talk about why a PleurX catheter might be recommended. Some people can develop a buildup of fluid around their lungs called a pleural effusion or in the abdomen known as ascites. This can make it hard to breathe or make you very uncomfortable. I assume most people watching this video are already dealing with these problems and probably have undergone procedures to remove fluid from the chest, which is called a thoracentesis, or from the abdomen, which is called a paracentesis. So during this video, I'll be referring to these catheters as PleurX catheters, although PleurX is just a brand name of a catheter made by BD. But there's also another catheter that's also very good called Aspira, which is made by Merit, and essentially they are about the same. So these catheters are small flexible tubes that are designed to be able to drain the fluid at home, giving you relief and more control over your symptoms. So who are good candidates for a PleurX catheter? This procedure is typically recommended for people with the recurrent fluid buildup caused by conditions like cancer, liver disease, or heart failure. If the fluid keeps coming back despite multiple procedures, diuretics, and other treatments for the underlying cause, then you may be a good candidate for this procedure. This is especially helpful when the procedures to remove the fluid are happening very frequently, like weekly or every other week. In these cases, it will be a good option for you. And if you're going through this, you understand the issue very well. The problem is that when you, let's say, do a paracentesis and remove, for example, 4 liters of fluid, which is, by the way, 8 pounds of weight, usually the patients need to recover from the procedure for a day or two, and then probably half of the fluid may come back in a day or two. Then the patient is okay for some time, but then is uncomfortable again for several days or even weeks until the next procedure happens. Sometimes it even becomes an emergency. The PleurX catheter allows you to drain a smaller amount of fluid each time, let's say daily, every other day, or even every 3-4 days, so you do not have side effects from having large fluid shifts. You also start having a more stable life, so you do not have the uncomfortable periods between the procedures, which is very nice. So I've been doing this for over 15 years, and I can say that most patients, by the time they do get the PleurX, they feel like they should have done this a lot earlier, because they feel a lot better and their quality of life is so much improved. Now let's go over how the procedure is done. It is a minimally invasive procedure performed under local anesthesia. It's actually not very much different than a paracentesis or a thoracentesis. It can be done with local anesthesia only. However, most of the time we use moderate sedation, which is that twilight anesthesia where we give medication in IV so you're more comfortable during the procedure. Most of the time you actually do not remember the procedure. Then, using ultrasound or CT imaging, we introduce the catheter into the area of the fluid buildup, either in the chest or the abdomen. The catheter is then secured in place with a small cuff to keep it stable and prevent it from falling out. We also tunnel the catheter under the skin to prevent infections, and that's why you may have 2 very small incisions of 3 to 4 millimeters each. The whole procedure usually takes about 5 to 10 minutes, and of course, during the procedure, we'll remove all the fluid that you have. Most patients are concerned about the risk of an infection, and obviously we are concerned too. However, as opposed to what you would think, it's actually very, very rare. If there is an infection, the way that you would know is you would develop pain and redness at the site. Certainly, if the catheter gets infected, it will need to be removed. You can be sure we'll take every precaution to minimize that risk as well. There's also a small risk of bleeding and a risk of injuring an internal organ. However, because we do this under imaging guidance, these complications are very, very rare. After the procedure, you'll go home with your catheter in place, and you may have some soreness for a few days, but most patients actually feel much better because the fluid's gone. We apply a sterile dressing immediately after the procedure, but you should be changing the dressing often to make sure the site is dry. After a week or two, you'll be able to shower and clean the area with soap and water. As far as the dressing goes, every drainage they will give you a new dressing to place, but in my opinion the dressing is fairly complicated, and my suggestion is to use just one of these 4-inch bandages that you can buy at any CVS or even Amazon. Now I'm going to show you how to use the catheter for drainage. Using the catheter is very simple. You will connect to a drainage bottle that will be sent to your house by the company, and you just let the fluid out. The process usually takes about 10 to 15 minutes and can be done as often as you need. You should schedule a regular follow-up with us to ensure that everything is working smoothly. Here's the thing, when you're draining the fluid, it should not be painful, except for that last little bit of fluid. So when you have any discomfort or pain, you should stop the drainage. So the goal here is not to drain every little bit of fluid, but it's basically to decrease the amount of fluid so you're comfortable. So if you start having pain, just stop it. How do you decide how much fluid to drain? Well, that's just a little bit of common sense, and it can change over time, requiring adjustments. Usually, we start draining 500 ml or 1 liter daily or every 2 days, and you see how much is coming out. If you're taking the entire amount every day, the entire 500 ml bottle or the entire 1 liter bottle, then you just continue to do what you're doing. But at some point, you will likely start to decrease the amount of drainage. So if you drain only half of the amount that you usually drain, then you can double the time between the drainages. For example, if you're usually draining 1 liter every 2 days, and then with time you start draining only 500 every 2 days, then that means you can start draining every 4 days instead. And we'll continue the adjustments as necessary. You can always send a message to my team and you can help adjust the timing of the drainages. Now, this is the exciting thing about these catheters. Sometimes after a few weeks or a few months, every time you drain, there's really not a lot of drainage. At that point, what we need to do is we need to get some sort of imaging, like a CT scan or an ultrasound, to see if there is any fluid left there. But most often what happens is you just stop building fluid, and if the imaging does not show any significant amount of fluid, then we can actually remove the catheter, and it will be very unlikely that the fluid will come back. Those are happy times. But of course, if the imaging shows that you still have fluid but you can't drain it, then we need to troubleshoot. You see, sometimes patients can develop some loculations or compartmentalization of the fluid over time, which could cause the catheter not to drain. It means that the catheter is located in one pocket of the fluid, but you have multiple other pockets around that are not draining. In those situations, sometimes we try to inject a medication that will break those little walls between the pockets, but sometimes we need to reposition the catheter. We'll be happy to troubleshoot with you. In summary, the PleurX Catheter is a safe and effective way to manage fluid buildup and improve the quality of life. As always, if you have more questions, feel free to reach out.